All right. Hi, good evening, everyone. My name is USMLE, and welcome to tonight's webinar, which is about the path to USMLE success, or the first aid for the USMLE Step 1, the really short version. Appreciate many of you who are joining, even despite some of the inclement weather, particularly in the southeast of the United States with Hurricane Ian coming through. So, we'll obviously try to make this as useful as we can for all of you, and also for many of you who are connecting with us internationally as well too. So again, my name is USMLE. I am an associate clinical professor of allergy immunology at the University of Louisville, but I suspect I'm better known as the editor-in-chief for the First Aid for the USMLE series. I'm also the founder and chief education officer for the USMLE-Rx question banks and USMLE-Rx 360 review platform, as also and also Scholar-Rx, our digital education platform. We would have with us a very special guest, one of our advisors and coaches, Richard. Richard, would you like to introduce yourself?
Thank you very much, Dr. Lee. Good evening, everyone. My name is Dr. Richard Blumengolds. I'm an internal medicine resident here in Miami, Florida, and I will be answering your questions in the question box.
Very good, very good. Normally we have a couple of folks that we're a little short-staffed tonight, so go easy on Richard. He'll do his best to stay on top of questions. Some of our other colleagues, Jeff and Luis, might occasionally pipe in as well. And then the other thing to make you aware, we will be doing a drawing for our USMLE-Rx 360 package. That includes bricks, our question banks, flashcards, and videos. So if you're around at the very end and we call your name, you can be eligible for a gift. We'll be pulling out 2 of those packages, so do hang around, and hopefully your name gets drawn out of the digital hat. All right, so let's get going. So the very first word in First Aid for the USMLE is relax. That's been the word since the very first edition, and it's been very deliberate and intentional that we did that, because we really want you to think about approaching the USMLE like a long-term process, like a marathon. And so, this is not about rushing it. This is not about panicking and going out and reflexively doing things. This is really thinking about really taking a deep breath, separating yourself from the situation, stepping back, and thinking how you can strategically approach this important exam. So, in the next 40 minutes or so, we will cover the basics. We'll talk about defining goals. We'll provide a couple of USMLE updates, because things always seem to be happening with the USMLE. We'll talk about setting up timelines for studying, how you approach subjects, choosing prep resources, some general study advice, and then we have the raffle, as I mentioned, and then we have some Q&A at the very end. I do believe we also have a special offer as well. So for those of you who are with us tonight. All right, so let's jump in. I want to learn more about you folks. So I am going to open up a poll, and I want to find out who are you. So you should see a question pop up on your screen. So you should be able to tap on an answer, and I'll leave it open for 15, 20 seconds, 30 seconds, so we can collect some responses and see who's out there, and then find out, and then go from there. All right, looks like about a third of you have already responded. Let's see, nearly half of you responded. I'll wait for another 5-10 seconds. I'd love to get 70% response rate, just to make sure you folks are out there awake, and interactive with me. All right, so I'm going to go ahead and close the poll and share the responses. And as you can see, the majority of folks are international medical graduates. We do have some US students that are both allopathic and osteopathic, so welcome. Great to have you here. I will then ask you another question, which is, when do you plan to take the USMLE? Is it really soon or sometime next year? So again, take a moment to answer that question. I'll keep the poll question open for, again, another 25 to 30 seconds. It does take a while for the responses to tabulate. I know we have quite a few international participants, and that may be what slows things down a little bit. But I am seeing the numbers tally in. We're now at around 60%. I'll wait a couple more seconds, and I will then share the results. And what we see is that most folks are taking it next year. Some there looks to be a spike in the winter time from January, March, and then there is another spike in August. Very interesting that what we're not seeing is we're not seeing the usual spike in the April through June timeframe. That's interesting because normally that's where the spike is, and I think that may be a matter that may be tied to the majority of the participants being from outside the United States, and again with and it could be tied to USMLE pass as well too. It's been it's certainly been quite a bit of change with the USMLE. Given that there are what appears to be a lot of international participation, I'd love to know where you folks are coming from. So if you could see the question box, there's a place where you can ask questions. If you go to the question box and just say where you're from, love to see what country, what state you're from. I'll try my best to kind of call out where people are from. So I see someone from Jamaica, India, Ghana, Italy, Israel, Texas, local, Bangladesh, Ghana again, Dominican Republic, Ghana, 3 folks from Ghana, Barbados, Ireland, Nepal, Nigeria. Yeah, so we've got quite Pakistan, Egypt, Nigeria, 1 o'clock in the morning. So sorry. Philippines, Louisiana, Egypt, New Jersey, Florida. So some people say New Jersey is a different country. Barbados, Tennessee, Honduras, Philippines, California. So Ross, Barbados, Egypt, 2 a.m. Again, very sorry, but I'm glad you guys could join us. Jordan, probably 3 o'clock, who knows. Ethiopia, Belarus. Oh, wow, that's way out there. Guyana. So lots of folks from Africa, Asia, Tunisia. So it's really exciting to see so many international participants. Thank you again for sharing your location. Ecuador, that's a lovely place. Visited that when I was in college. Okay, so there you go. All right, so yeah, Florida. Sorry for the sad face. So glad that you still have power. Virginia, St. Kitts, Dominican Republic. Okay, great. So anyway, let's go on. So for all of you folks, the USMLE is this 1-day exam, 8 hours, 280 questions in 7 1-hour blocks. So that makes it 40 questions per block. You get a minimum of 45 minutes of break time. So you can see over here, I've got a little schematic here of those 7 1-hour blocks. Those are the blue blocks. The red block over here is the orientation block, and you are given 15 minutes for that. And the trick to know here is that this is the same. Orientation module that you can get if you go to USMLE.org and download their orientation materials. So the trick is to go ahead and do that on your own before you come in for the exam. And when you come in for exam, you only go in this for 1 or 2 minutes just to adjust the volume on your headphones, and then you exit as quick as you can, and then you should be able to capture most of that 15 minutes. So you should be able to start off with roughly 60 minutes of break time. And we'll talk a little bit about how you can gain even more a little later on. All right, next we're going to talk about the question types. So there's really only one main question type, which is the single best answer. You will have some variance that will have a little bit of multimedia. Most of these best answer, single best answer will have some sort of scenario, typically a case vignette, and the majority of them will have multi-step reasoning. And so what that means is that they're going to integrate multiple concepts together. So they may integrate pathology, then diagnosis, or pathology and treatment, or pathology and pathophysiology, pathology and genetics, or epidemiology scenario, and some, some stats concept or whatnot. And you're going to see that in the majority of the items. It's not all the items, but the majority of the items. You will also see single-step items as well too. So, here, for example, is what you might consider a multi-step question. So you may see a scenario where a 32-year-old woman presents with several days of occasional double vision and bilateral ptosis, and then you go into the actual question and it asks, what is the most appropriate diagnostic test? And so when you start to break down this question and dissect it, you'll notice that it's not asking what you think it should ask, which is what is the diagnosis, right? So you're working through the diagnosis. That's what obviously you go to, but it actually asks, well, how do you actually make that diagnosis? So so automatically you'll be able to ascertain that this is at least a two-step question. So the first step is to come up with what is the most likely diagnosis based on this clinical presentation. And then that's being step one. And then step two is, well, then what would be the most proper diagnosis test that would give you that diagnosis, right? So that's step number two. So in this particular case, the answer to step one is likely going to be something like myasthenia gravis. You could argue for something like multiple sclerosis, particularly, this being a younger woman. But it tends to have more asymmetric unilateral findings as opposed to this bilateral ptosis and other findings that appear to be affecting both sides. And so, if you do believe that this is myasthenia gravis, then what is the most appropriate diagnostic test? In this particular case, it's going to be anti-acetylcholinesterase antibodies. Receptor antibodies, and if you're outside the United States, or this was several years ago, the other test, the classic test, which is no longer used, is hydrophonium challenge, which is, or otherwise known as the tensilon challenge, or the tensilon test. It being a short-acting acetylcholinesterase receptor inhibitor, that can quickly, temporarily reverse some of these findings and make that diagnosis, but that's no longer available in the U.S. But again, that being said, here you have an example of a two-step question, and so you're just going to have to get used to, reasoning your way through these questions. And in fact, that's actually how we designed the USMLE-Rx question bank. When we give you the explanation, you'll notice that it's a multi-step question. We stepwise walk you through the reasoning process to get through each step. All right. So let's move on. Let's talk about the actual interface itself. It's quite simple, and obviously, if you've done any question bank like USMLE-Rx or UWorld or anything like that, you'll be quite familiar with this interface already. You'll see that here is the stem, here's the lead-in, which is the actual question. Most of the questions have 5 responses. Sometimes they're 4, sometimes it can be 6, but most of the time it's going to be 5, occasionally 7. And about 15 to 20% of the time, you're going to have some sort of image, diagram, or some sort of visual information that goes along with the stem. You got navigation across the top and navigation across the side. You have your timers at the bottom, so the time remaining in the block, and also the time remaining during the day. You can certainly lock your exam, say if you need to go use the bathroom or something like that, but the timer will continue to run. It only stops if you end the block or you run out of time. Now, if you couple of things, when you answer a question, you can go back and change the answer anytime you want within the block. Once you exit the block, you cannot go back in and change any of those responses. The other thing that you want to know is that if you end the block and there's still time left on the block timer, let's say there's 5 minutes left and you exit. Those 5 minutes then go to the time you have left in the rest of the day for breaks and lunch and stuff like that. So that's how you can gain even more than the 1 hour that I told you could start off with, at the very beginning of the test. All right, so let's talk about passing, scoring, and so forth. As we all know, the exam has been pass-fail since the beginning of the year. Passing is geared at 196 in the old 3-digit scoring system. It went up from 194, and historically the reported mean is around 231 with a standard deviation of 20 points. U.S. medical students, including osteopathic students, essentially pass on the first try. IMGs can essentially pass within 3 tries. It's a little tougher on the first try, but for international students, you can pass, or you have a high likelihood of passing within 3 attempts. Again, before the exam went pass-fail, this is you can see that you could graph the data by step 1 score and percentile, and roughly 5 to 6 percentile is where you see the minimum passing threshold. And you can see that historically, from a percentile standpoint, you kind of hit 99th percentile around 260, 270, and it essentially flattens out there. All right, so that's just historical context. Again, historically, USMLE Step 1 has been used as a screening tool. So this is the infamous mnemonic: roads to riches, radiology, radiation oncology, the surgical subspecialties, plastic surgery and dermatology, are traditionally extremely competitive because they have very few positions, and they're attractive in many ways, including remuneration, and so it tends to be oversubscribed. Now that USMLE Step 1 has gone away as a screen tool, it's going to be shifting to USMLE Step 2 CK. So, unfortunately, in some ways, this only unfortunately kicks the can down the road until they can find a better set of tools that will allow residency program directors to sift through the enormous number of applications they receive. All right, so as I mentioned, there's a couple of USMLE updates that I'll just pass along. You already know about the passing standard that went up to 196. That's been around for 9 months now, but still worth bearing out, especially if you've already had some experience with USMLE Step 1 from last year. And then also a couple of months ago, USMLE Step 2 CK did raise its passing standard from 209 to 214. So 5 points, that's actually a bit of a sizable jump, but it hadn't changed for a couple of years. And so that may explain why it took that size of a leap. All right, so let's talk about choosing your study strategy. So obviously, all of you have gotten this far. You've made it to medical school, so you generally have your go-to learning preferences, your study strategies, and so forth. We'll do a quick review of what's high yield and what's good evidence base. But certainly, you're going to want to take into account the structure and characteristics of the subject that you're studying, and also how your curriculum is structured and where it has strengths and where it's not. And then time assigned to any particular system or subject when you're studying. So for example, if you're studying for something like pathology, which everybody does, and they spend gobs and gobs of time on it, you're going to have more strategies available. Whereas if you're studying something that is much more limited, like say neuroanatomy or embryology or something like that, you're going to you're going to have limited time, so therefore you're going to stick with some core approaches, which we'll talk about in just a little bit. In the next 8 to 10 minutes, I'm going to spend some time talking about traditional talk about how you can approach these various subjects. And again, just a reminder, if you have questions along the way, feel free to pop them into the question box. And again, Richard is going to try to stay with you, as is Jeff and others, and Louise, with whatever questions they can answer for you while I continue with the presentation. So in any case, you will see, as I go through these subject areas, that obviously they should apply across organ systems. That's number one. Number two, you're going to see, and then you're going to see a couple of themes that I'll kind of hit on, over and over again. So the first theme that you're going to see is that, despite them calling the USMLE Step 1 a basics science exam, it really is in some ways a clinical exam, because almost everything they test, number one, has clinical relevance, and number two, most of the questions start with a clinical case vignette, which for the most part tends to be unrealistic. They're not trying to give you things that are contrived, that can never happen in the real world, or so. And for the most part, they except in a couple of cases, they generally don't do as much super nitpicky, esoteric stuff. It's the type of stuff that you would expect to see. It just happens that the people writing these items are clinical experts themselves, right? So they kind of know what's going on in the field, and they know what's kind of important, right? So again, that's one theme to keep in mind, is clinical relevance, and that's going to cover across. The other thing you're going to see is that you'll as I go through other subject areas, that you'll need to start cross-connecting all these subject areas and discipline areas and organ system areas, because that's how you structure these multi-step questions. As I mentioned, and some of these areas are going to be within a certain subject, like neuroanatomy, embryology, are going to be very limited. And fortunately, there's not a lot of rapid evolution in these areas, so there's not a ton of controversy about what kind of tends to show up here, but they do get integrated to these case vignettes. And again, tied to the idea of clinical relevance, when you see things and structures on the exam with images and so forth, it's not going to be cadaveric anatomy and stuff like that. It's going to be clinical imaging, right? Because that's the whole point, right? You want to work on your patients while they're still alive. When they're a cadaver, that's kind of becomes a bit more of a moot point unless you're a pathologist. So you're going to see X-rays and CTs and electron micrographs and photographs from tissues of live patients. So that's what you're going to be seeing the majority of the time. Biochemistry is the next area I'll spend a minute or two on, and it is a crammable area, and there's a couple of these things, and the reason why they are crammable is because there are the structure of the information, particularly metabolic pathways, tends to be pretty predictable and recurring. So you don't have to memorize or learn many new logic frameworks. It's pretty much the same stuff. They're just swapping out the substrates and the enzymes and where the pathway is. You just need to fill in those blanks. But again, think about what's clinically relevant. So that's going to be vitamin deficiencies, genetic disorders, and the key regulatory enzymes that might be involved in that. So that's the pathobiochemistry. And then you might want to think about what are the lab techniques that are really relevant in biomedical science. So benchtop science, including things like RT-PCR, Southern blot, Western blot, and also how they are used in lab medicine, right? So how to use things like flow cytometry to diagnose immunodeficiency, for example. All right, microbiology and immunology also crammed, particularly the the bugs, bacteriology, and viruses, and parasites, and so forth. But just remember, it's not just bacteriology, right? There's all these other areas. And again, the reason it's crammable because there is a repeatable logic framework of how you can relate the bugs to distinguished characteristics, the target organs, how they get there, diagnosis, vectors, reservoirs, treatment, and so forth. And so again, tends to be a little bit more crammable. On the immunology side, obviously in this new age of COVID, the immune response and how vaccines work are tremendously, first of all, you got to know it just because it's, more than ever, it's just a huge part of your life. And it's going to permeate everything we do in medicine. But it's just, but it's also very testable. All right, pathology, as I mentioned, everybody's going to spend a lot of time on pathology. We know it's a big topic, and you need to do well in it, even if you just want to pass, and you're not trying to, try to do the high pass or get the proverbial, what we just call the 250, 260, even before USMLE pass-fail took effect there. And with pathology, a couple of things to keep in mind. The clinical presentation can have a lot of variation for very common diagnoses like heart failure, diabetes, asthma. Like for example, we tend to think of asthma as wheezing and shortness of breath, but in the pediatric population in particular, you can have asthma just showing up like a dry cough. So you're gonna have to look for other clues. They may put other clues in the gender, ethnicity, age, and so forth. But remember, they're not gonna they may give you they may give you clues, but be sure not to overread those clues. So for example, just because it's a Black young woman who has nodules doesn't always necessarily mean that it's always going to be, sarcoidosis or something like that. Sarcoidosis can, if it's a patient that also has lung nodules and it happens to be a white male, that could also be sarcoidosis. Just because in first aid we say typically presents doesn't mean, that's what you're dealing with, because again, on the USMLE, it doesn't have to be a typical presentation, okay? The other thing to think about are those buzzwords, or we call them trigger words, right? And we use them as mnemonic-like devices in first aid for the USMLE Step 1, and other high-yield books do the same. But remember, on the USMLE, they're gonna give you a neutral description of those findings and whatnot. They're not gonna necessarily give you the buzzwords. And again, if you do enough questions, particularly after you've done a couple thousand questions, you'll be able to pick up on those neutral descriptions for most of those findings. Lastly, pathology is where you typically get a lot of images like path or histoimages or clinical images. The good news is that the majority of the time they can be answered from the clinical history. Even if they're confusing, even if you don't know what the orientation is, or even you can't tell whether that's an H&E stain versus something else. So the key thing is to go through the history first. When you do your question dissection, obviously we advocate doing a couple of different ways, but looking at the image should be done. However you decide to dissect a question, looking at the image should be done after you go through the history, because the image, like I said, if you look at it before the doing the STEM, you will be missing a lot of context. All right, pharmacology, like biochemistry and microbe, is crammable because again there are repeatable, testable relationships or logical relationships with tied to mechanisms of action and toxicities. They do not test treatment questions anymore, so they're not going to be asking you what's the best treatment for asthma, or what's the best treatment for X, Y, and Z. You're going to see most of that has been moved to USMLE Step 2 CK. All right, but they may ask about class effects or treatment by classes. So you still, I think it's a false dichotomy. I still think you need to learn it anyway, because number one, you're going to see it as soon as you hit the wards, and number two, it makes more sense and as a bonus, you're preparing for the Step 2 CK. In terms of, at the very least, you want to focus on the prototypes and the major variants. If you really want to ace it, you can go after the minor variants or even the obscure derivatives. There's in no case do you ever need to memorize the trade names of dosage or the route of administration. The trade names may be helpful if you want to use it as a mnemonic device. And then you got to make sure that you integrate it. Again, that's the theme we're going to go back to again. You got to integrate with everything else, particularly since pharmacology does get tied to therapeutics. So you want to tie it to the pathology, the physiology, genetics, and so forth. Particularly if there is a mechanistic explanation that explains why that drug works, versus something that's idiosyncratic or it just, quote unquote, it just does, right? All right, physiology, concept-oriented, and so in terms of approaching that, diagrams work well because you can help you understand the relationships. And here, it's really understanding the relationship about how hormones impact each other or other pathways, like the HPA, the hypothalamic pituitary adrenal axis and all that type of stuff. And again, almost always you'll see the physiology with pathology, in the form of a clinical vignette. Psychiatry on the Step 1 includes some related fields like psychology, psychopharmacology, sociology. We tend to focus on the mood disorders like depression, but you need to think about personality disorders and other disorders that we cover all the core ones in first aid. So again, use that as a organizing framework for your psych study. All right, public health. Traditionally, you'll see biostats, ethics, but in the last 5 or 6 years, we've seen more healthcare delivery, patient safety, and quality improvement. We often also call that health system science, and then doctor-patient interactions, especially in the last 3-4 years, have been more prominent on the Step 1, and we certainly bulked up our question bank to address those types of scenarios. All right, so let's talk about. So again, that was a quick walkthrough the high yield areas in those subject areas. All this information is available at our blog at firstaidteam.com. Jeff can drop that link there for you in the chat, you can go there and get a copy of this presentation. I'll show you how to navigate to it a little bit later. All the information is there. Now let's talk about review resources. Now there's a number of things that are out there: text reviews, test banks, videos, digital platform, flashcards, review courses, all kinds of stuff out there. And the key thing is the key realization, obviously, is you don't have all the time in the world, and you certainly don't have all the budget in the world. Some of us are still paying off our medical school debt, years, if not decades, after getting out of residency. But a couple of things to keep in mind. One is you can check out our resource reviews at First Aid USMLE Step 1. There's a short version in the book, and then there is the expanded version on our blog at firstaidteam.com, and I'll show you where that is. A couple of pointers. One is, start using those apps and resources and websites and so forth early on, with your curriculum and your coursework if possible. Buy only what you use. Try not to overbuy. Most of these things are on demand. If it's a book, even if it's a book, you can get it from Amazon or Barnes and Noble within a day or two. And certainly, if it's a digital resource, it's it's instant demand. And just also realize that some resources are good in certain areas, like micro, and maybe not so great in other areas. So you gotta look at each of the resources critically and by systems or by subject area. All right, so I'm gonna see if you guys are still awake and with me. I am going to ask another question. So let me pop up the poll question here, and let me get to that question. And I'm gonna watch this. This one you might have to think for a second or two, because it asks any of the above. It could be more than one or two, it could be all of them, in terms of what's useful or what you're going to be using to prepare for the USMLE Step 1. So take a second or two. And again, we're going to leave this open for about 30 seconds again to tally all the results. Looks like about 20% of you folks have answered. So we'll keep it going. Starting to see the data trickle in. We'll hold it open for a couple more seconds. We're at about 65, 70%. Good. We're at 70%. I'm going to go ahead and close the poll and share the results. As you can see, almost everybody does a question bank. The majority of folks are doing some sort of video review as well too, and question or review books like First Aid, of course. And then many of you guys are also doing other things like flashcards and mobile apps and so forth. So there's a lot of popular resources out there, that can be helpful. So so that's good to share. I'm going to go ahead and minimize that. So now let's talk about some general preparation advice that has been helpful for students and IMGs throughout the year. So one is, make sure you have a deliberate, grounded approach to establishing study schedule. We have such a tool. It's our USMLE study planner, or Rx study planner. I think Jeff just dropped that link into the chat a couple of minutes ago. So check that out. Because once you do that, you should be able to stick with it, because it's going to help you, organize and also plan your breaks and stuff like that. Number two, as I mentioned, you want to integrate and apply everything. So think about how each fact you learn, each concept can be integrated with other concepts. Always think about when you observe something, like, hey, a patient who gets a certain type of strep infection, has a fever and a rash. Think about why that is. Always ask why and how. Okay, here's the I see this. I see this is how it happens. Then ask why and how, and then how can this be integrated with other related concepts. So integrate the pathology, the physiology, the diagnosis, therapeutics, wherever you can. All right. So that is an example of cognitive integration. Those crammable subjects that I talked to you about a little earlier, like biochemistry and micro and pharmacology. Again, try to again still learn them in an integrated manner, and also learn them as you go through your curriculum. But when you do have some time towards the very end, in a week or two, where you might cram a little bit, that's where you might go back to these crammable areas, because it's easy in. Now remember, it's also easy out, so that's why you do it right before the exam and not like months before. Again, just to be clear here, we don't recommend you cram for the exam. That's not a good way to succeed. But in the last week or two, you can cheat over a little bit and do a little bit of cramming just to get some of those high yield facts in there. With the crammable subjects and what you see in our high yield rapid review. Always focus on what has been previously learned, and that's high yield. It's easier to reactivate and retrieve old memories than it is to learn brand new ones, even if it's considered high yield. So think about that first. Go there first with the previous learned stuff before you try to learn brand new stuff. As I mentioned, make sure you do not overschedule. And again, our study planner will help you do that. Just use that link that Jeff shared. Make sure you give yourself some time to be a human being. As I mentioned, you got to think about this as a marathon, not a sprint. We do have a tracking checklist at the beginning of our book, right after the acknowledgement and introduction, or right before the first chapter, that will give you a planning rubric that will get you ready for the boards in a way that will not skip steps and avoid you getting into a panic situation. So I'll pause there and see, Richard, since you've been tutoring some of our students and whatnot, whether you have any similar advice or different advice, or anything you want to add to these study tips.
Yes, thank you, Dr. Lee. I actually agree with everything that you've had to say. I think the one point we really want to try and drive home is the integration of the subjects. The body and the organ systems and all the pathologies that you learn, if they don't happen in a vacuum. If there's something happens to the level of the kidney, the heart and lungs know about it. So make sure when you're studying, you are doing, as Dr. Lee says, and integrating those subjects together and thinking of how else can they ask this question. Because just because it's in the bank doesn't mean it's going to be asked exactly the same on the actual test day. They may change words, they may use descriptors. So it's important to think about it, as Dr. Lee said, from a different perspective each time.
Absolutely. And the other way you can think about it is when you're doing your USMLE review, let's say you're using the USMLE-Rx and you're doing some questions and you happen to get the answer right. Maybe you didn't know and it turned out, it was some shortness of breath and wheezing and the answer was asthma. But let's say the other distractors was COPD or bronchiectasis or heart failure or whatever, other things that could cause shortness of breath and wheezing. Then you might want to think to yourself, okay, well, I did get this right, but what would I have to change in the STEM to make COPD the right answer, or bronchiectasis the right answer, or congestive heart failure the right answer? So that's how you can expand and kind of power up really on your USMLE review, even though the original question was just about asthma. All right, so let's keep on rolling. So this is a computer-based test. That's what CBT stands for. So there is a tutorial we already talked about. There are some shortcuts, keyboard shortcuts. Most people don't know about it, but it's worth keeping in mind, especially if you use both your hand and you're using both the mouse and the keyboard. And we, by now you've already heard from everybody, from your classmates to the deans, that you want to be doing questions throughout in the end. And there's a ton of science that's tied to that. That was published in the Journal of Science. That's what the logo I just showed you, and was popularized in the New York Times several years ago, where they did show that when you do retrieval practice, which is basically self-testing, including using a question bank, could also be a flashcard, you just do better, even versus, cramming at once versus cramming at multiple times or using concept mappings. And this even applies to, more challenging inferential questions. So when it comes to practice testing, you can certainly use the USMLE sample exam. It's free. It's helpful for format familiarity. You can use the NBME, CBSSA. That's a comprehensive basic science self-assessment. There's often 5 or 6 versions floating out. They always retire a couple and then they add a couple. They're about $40 to $60 a piece. They're useful for benchmarking. They'll give you a probability of passing the exam. And then there are Q banks like USMLE-Rx and UWorld and so forth, which is also helpful for practice studying. And we'll also give you an assessment of the percentage, what we think you would have gotten if it was a real score, and then also the confidence interval passing. All right, now let's talk about the evidence-based study techniques, right? I think one thing that you want to keep in mind is that there's plenty of advice out there, right? There's no shortage of advice, right? You just go to Reddit, just go to studentdoctor.net, and every I think everybody has advice, and I think everybody's well-meaning, but you got to keep in mind that everybody's advice is based on an N of 1. It's based on their, what worked for them. And there's no way to tell whether that's actually really what worked or not, because again, think like a scientist. Think like a physician who's reading, New England Journal of Medicine. They're not conducting a randomized, blinded, placebo-controlled study on themselves, right? There's no way. So, everybody's advice is unfortunately one way or the other is going to be subject to various biases, right? So that being said, what do we know that's actually published in the literature, particularly the peer-reviewed literature? So this is what we do know. One is that question banks, are more effective than flashcards. Now, that's not a shocker, and I think most students would say that, even if they didn't run the study themselves. But somebody actually did run the study, and it was well designed out of Washington University, St. Louis. And so, they found pound for pound question banks are more effective. And it is tied to a learning theory, which is called transfer appropriate processing, where, and again, I think it makes sense. If you're, LeBron James and you wanna improve your free throw percentage, well, then you do free throws. And instead of doing tomahawk dunks, right? Tomahawk dunks may be pretty, but it's not gonna improve your free throw percentage. So QBanks look more and behave more like the real thing versus flashcards. Now, the next question that has been asked in the literature is, how many questions do you have to do in question banks to do better on the boards? And it's roughly between 300 and 450 questions for one additional point on the board. Now, it's of course all theoretical because it's now pass-fail, but that's what you want to keep in mind. So for example, if you did all of USMLE-Rx, and we've done this particular study, you can get about 10 points on the boards extra by doing our entire question bank. And again, this is backed by multiple studies that agree with each other. Another question is, how many questions do you need to do for the best performance? So in the best study that we found out of the University of Michigan, students who did roughly more than 3,000 questions, did better. And it turns out that it had to be unique questions. So in other words, these were questions that were not repeated questions. So you might have been given advice, hey, do X, Y, Z question bank 3 times, and that's all you need. Now, it may be good for studying, but in terms of harnessing the testing effect, it's not helpful because you often get tricked into thinking you know better and performing better through a phenomenon called fluency. Fluency just simply means you think you're doing better when you're actually not doing better. You do that question against, and you think you got it right because of the merits in the clinical presentation, but it turns out you actually got it right because you unconsciously memorized that pattern, or there was a unique little detail, like it was a patient wearing a checkered shirt, checkered flannel shirt or something like that, and that's what triggered you to make that association, which is a false association, in which wouldn't a priority have meant anything if you had never seen that question before, right? So again, that's fluency tricking you. So that's why it has to be unique multiple choice questions. And then lastly, the Michigan study did show that students who did 3 passes or more through first aid step 1 did do better than students who did not. So again, we did not do that study. They had nothing to do with us. So that's what we know. That's in the published peer-reviewed literature. You're not going to find this on Reddit, or unless somebody is quoting these studies to you. And then lastly, some test day tips. These are more common sense, practical things. One is a lot of us tend to be jacked up on test day, so do watch your coffee. The Prometric Testing Center can be cold, particularly because it's in an air-conditioned environment or in the morning. So bring in layered clothing so you can adjust for cold or even hot environment. Occasionally it can get warm if there's direct sunlight and it's not being blocked in the center. As I mentioned, you will have 90 seconds per question. So 40 questions in one block. But if it looks like it's really a long question, make sure that you have a go-to question dissection technique. We do that on our webinars as well too. So Richard and Sean and Paras and others folks will show you our question dissection technique. But it does involve reading the lead-in before you work your way through the stem. And that is particularly true for long questions. You kind of want to know what they're going after before you dig through the clinical scenario. In terms of managing the clock, with 40 questions, we advise that you try to, give your best available answer within 70 to 75 seconds. If you do that and you mark off up to maybe 10 solvable questions, then when you get to the end of the 40 questions, you'll still have 12 to 15 minutes left. You can use that to go back and try to solve those 10 questions that have been harder, that maybe you just needed to rule out one more distractor to get it to so where you can even the odds or whatever. Keep in mind that in general, second guessing actually gives in general and on average improves your score. It's false that second guessing is worse. That's been proven in exams like the SAT, and it's also been improved in exams like the USMLE. You need to make sure you have time and you've got to be deliberate about it, and you can't go after too many questions. Otherwise, you won't have time to rework through the logic process. Again, you should have an hour and maybe more for breaks. You're certainly going to want to have snacks or a light lunch somewhere during the day, and part of the strategy is finding out when to take a break. And you need to align that with the time of the day where you tend to run on energy, right? When you're good on energy, you're cruising, you're grooving, you got to stay in the zone, right? And just keep punching out questions. But then take your breaks when you know you're about to lose energy and so forth. And if you don't know when that is, then you can go to USMLE-Rx, create a full day simulation, and then use that to find out when the low tide is for you, so you know when to schedule in your breaks. Lastly, you need to keep in mind that sometimes the exam will seem easy. Other times the exam is going to be really hard. There are dozens and dozens of variations of the exam, and they're not all equal, including in terms of difficulty, because what they do is they scale the score to adjust for the difficulty of the exam. And also the subjects are going to change. You may have things that are super heavy on reproductive health or super light on genetics. You just don't know what you're going to get. There will be some questions that are going to be very hard. And if you cannot figure it out, then in fact, one of the things you might want to do is develop a skill, which is know when you don't know what's going on at all, right? If you cannot reason it out, if you're 20 to 30 seconds in and nothing is making sense whatsoever, and you can't reason it, or it's not tied to any concepts you studied before or you can recall, you need to know when to cut bait, when you cut loose and run. Because what you do is then you pick your favorite letter, which is B or C or A or whatever, and then you save the 80 second, or after 30 seconds you save the remaining 60 seconds, and you use that to go solve other questions that are more doable for you, right? And the last thing to keep in mind is that some of these questions are experimental. I think in some studies it can be up to 15–20% of the exam could be experimental questions that don't actually count towards your actual grade. Some of these questions are used as diagnostics to make sure the exam is performing well. Some of them may be new questions that they're testing out or whatnot, and they're trying to gather psychometric data. So again, if the question is unsolvable, be decisive. Say you don't know it, go to your go-to answer C and pray that it's one of those experimental questions and go on to something that is going to be more solvable. All right. So that's the story behind the C reflex.